title of our grant is HCE 005, Scaling Up Access to Preventive Malaria Intervention Through an Integrated Campaign Approach. This is the outline of presentation, and then the questions that this grant attempts to address are: when and how was or will collaborative microplanning be utilized in an integrated campaign? What were or are the challenges and opportunities related to collaborative microplanning? What was or is the capacity of and training needs of health workers in relation to integrated campaigns? And how this will now, how did or will campaigns collaborate in supply chain planning and logistic management, and then implications? And then there are a lot of issues lined out as shown on the slide. Then this is the project locations: Jigawa State in northwest Nigeria, and then Gombe State in northeast Nigeria. Then in terms of approaches, the goal of our project is to improve health campaign effectiveness through full or partial campaign integration and share promising practices in collaborative planning. The outcome is to scale up access to preventive malaria intervention through an integrated campaign. And then our objectives are to the activity, it includes activities include early consensus building meetings with all relevant stakeholders in order to establish clear roles and responsibilities for all stakeholders. We also work in close collaboration with NMEP, M&E branch on the use of National Malaria Data Repository platform for data collection and storage. Review and analyze engagement and advocacy tools and templates. Early development review of ITN and SMC campaign timelines. Focus on engagement meetings, advocacy visits, personnel needed, micro-planning, storage, logistics, and training. Review and analyze micro-planning templates, especially SMC and SMC into ITN P3D form. Then review specific budget lines pertaining to personnel costs, logistics, hiring of venues, material storage, warehouses, mHealth devices and its development. Then also observe stakeholders and perceptions regarding the degree to which the processes in the campaign guidelines, including plans, logistics, and budget transparencies, were adhered to. Mobilize the development of joint communication on the evaluation plan, then conduct key informant interviews, observation of key activities using KII guide and also checklist. So under stakeholders, the stakeholders in this activity are the health programs, of course. Prime Minister of Health, which is the National Malaria Elimination Programme, head of IVM branch and ITM campaign advisors, head of case management branch and SMC campaign team, State Ministry of Health, State Malaria Elimination Program team, State Primary Healthcare Development Agency, then the FGA Health Department. Then implementing partners include state malaria elimination programs, Malaria Consortium, Catholic Relief Services, Chemonics, which is a logistics firm, and then Red Rose. And then it will entail government engagement of government at all levels, both the federal, state, and then local government. Other stakeholders include integrated vector malaria sub-committee, also the case management sub-committee, then community traditional religious leaders, then community-based organizations. Then what are the stakeholder needs? Need one is smooth running of the campaigns, early engagement and buy-in of campaign manager and stakeholders at all levels to generate support and commitment, increase security of personnel, materials, and staff. Active community mobilization, which entails demand creation, strengthened with reinforcement of IPC by ITN health educators and community drug distributors on the utilization of health products. Capacity building and commodities mobilization, continuous training of campaign personnel, supportive supervision, and continuous use of volunteers for IPC to increase use of ITN as SMS. Need 4, dissemination of findings, results, and recommendations. This will entail workshops, coordination, subcommittee meetings, advocacy visits, dissemination events to inform stakeholders on need for policy change and integrated campaign guidelines. Need 5, realistic costing, financing, and budgeting. Budgetary provision for materials should be based on current market cost. Timely release and reimbursement of funds, state and FGA financial and logistic contributions to ITM and then SMC campaigns. What are the future application, advantages and limitations of the case study? The advantages include to eliminate or reduce reduction and engender reduction in operational, logistical, and implementation costs, and attain higher coverage of ITN and SMC campaigns. Targets same disease and similar population at household level. Use of adaptation of door-to-door strategy for both ITN and SMC campaigns with the advent of COVID-19, and that worked very well last year with during at the heat of the COVID situation. Then planning for integrated campaigns is conducted once and reduces competing health programs. Then use of same personnel at national level is also one of the advantages. Then what are the limitations? Limited field time in states, non-availability of key informants as a result of competing health programs, interference during KIIs. Then why ITN campaigns take place over 2 continuous months, SMC would take place over a few days in 4 consecutive months. This implies that few staff will at a stage switch from integrated mode to parallel mode to ensure implementation of all the both projects. Then lessons learned, same mix of personnel across ITN and SMC campaigns. This will lead to reduced costs, early involvement of key stakeholders at the subnational level. SMC can leverage on a well-received ITN campaigns by health workers at the community level. Competing other health interventions of program hinders smooth implementation. Inadequacy of the use of 2006 national data for campaign projections. Then hijack of personnel security by personnel recruitment by political leaders. That's interference in recruitment of field personnel. Weak joint supportive supervision at subnational level. Then harmonized M&E systems for ITN and SMC campaign. Advice: create database for trained personnel for future campaigns. Increase personnel and logistics for joint supportive supervision. Improve accuracy of registration via data triangulation of previous campaign and flagging variance between micro-planning and registration data. Build capacity at subnational level across the 2 interventions. Strengthen integrated monitoring and supervisory system and harmonize implementation tools. Thank you very much for your attention. And these are some of the documents we referenced. They are all as shown on the screen. Lessons learned for 2020 ITN mass campaigns in Nigeria. 2 is the HCE project plan developed by Ibolda Health International. The 3rd document is decision guiding toolkit for people-centered integration of health campaigns. Then report of the mass insecticide treated nest ITN and seasonal malaria chemoprevention distribution campaign in Zamfara State. Thank you.